Welcome to On the Beat. Gastroenterology associates in Columbus and Starkville are here with us today. Dr. Ricky Johnston and Dr. William Gillespie are joining me, and today we're going to talk about colon cancer screening. I asked you before we started recording, and it is the third most common cancer. So tell us a little bit about why and when I should have a screening for colon cancer.
It's a good question because that's changed a little bit in the last few years. But basically, everybody needs to have a colonoscopy starting at age 45 now. It used to be 50, but as I like to tell everybody, 45 is the new 50.
Okay.
And so once you turn 45, and this applies to everyone, even if you're not having any problems.
So regardless?
Regardless. If you feel completely well and have no symptoms at all, you still should have a colonoscopy.
So let's talk about what are those symptoms somebody might be experiencing that would cause alarm.
So the typical symptoms we call alarm symptoms would be bleeding when you go to the bathroom, abdominal pain that's new or severe. Weight loss is a big one. Unintentional weight loss, not if you're exercising and things, but if you all of a sudden lose 10 or 15 pounds for no reason. And then major changes in your bowel habits, lots of diarrhea or constipation all of a sudden with no change in your lifestyle. So those can kind of be signs of something going on.
One thing I like to throw in whenever we talk about symptoms of colon cancer is it could be none. You know, no symptoms at all. And to the point we made to start with about everybody should have one, and even if they're feeling well, colon cancer in the early stages may not cause symptoms. You could have it and not know it. So that's why screening is so important, to catch it early, to have your best chance to be able to do something about it.
And let's talk about that, catching it early, the success rates with catching it early.
It's very good if colonoscopy is it's a preventable or preventive procedure. We take out polyps so you don't get colon cancer. And generally, if you have normal genetics and you do your screening on time, it's very good at preventing any future colon cancer.
And some people have a fear of just tests in general. What should somebody expect before, during, and after the procedure?
Well, the procedure, there's lots of reasons people decide they don't want to do this or they're scared to do it. Some of it involves the preparation beforehand, which is not a fun experience. But for us to be able to see when we insert the scope and take a look, we need to be able to have everything cleaned out and be able to see the colon lining. And that requires going through the prep, which is a liquid diet, and then some laxatives that you'll have to take to help with the evacuation process. Other reasons people are anxious about having this might be the fear of the unknown. What's going to be found? They're scared that they'll have something that's is bad, and that keeps people from doing it. Some people don't like to be put to sleep. The anesthesia risk scares them. So there's various reasons people decide not to do it, but we try to talk people through it and let them know what to expect. But the prep, and then you come in for the procedure, they'll be put to sleep, and that they won't remember anything about it. A lot of people want to make sure that they're not going to remember the procedure, and then they wake up and we're done, and they go home and get back to normal activities the next day. So it's really just one day out of work. Yeah, and eat. That's the first question I get before I put people to sleep for this is, when can I eat again? And it's as soon as they leave the building.
Well, and I found it a very easy procedure and so much benefit than not having the procedure done. And then I didn't know this either, but there are other screening methods other than a colonoscopy. Is that correct?
Yes, there are. There's a few. There's some stool tests that can be ordered. Those are the big ones, and blood tests are kind of maybe on the horizon. We may want to devote an episode to that coming up soon about other alternative methods for doing that.
Yeah, because I think we only hear about colonoscopy, and so there might be other.
No, it is the best,
yes.
and we always push that. I mean, and not only for screening, but the preventative aspect of it. And other procedures don't offer the prevention that we can do with this.
Right, but all the other tests will tell you if you have cancer, but they won't prevent you from getting cancer.
Well, such good news for our viewers to know about, and really make sure that they stay up on the age for those screenings. Thank you both for being here. And that's On the Beat.